to try to understand why so many technology-supported change projects within health and social care often fail to meet the initial expectations, or at least fail to, scale up and become mainstreamed beyond the initial pilots or trials in which they were set up. And this work led to the development of what we call the NAS framework, which stands for non-adoption, abandonment, and challenges to scale up, spread, and sustainability. And when I say scale up, I mean scaling it up within an organisation, so making it sort of mainstream within that healthcare service. Spread means to spread to other organisations, so sort of replicating it in other places. And sustainability is the time dimension, so that it keeps on going beyond the project. And this framework was largely developed through a number of longitudinal studies that we did, looking at technology change projects within health and social care organisations. I won't go through all of these, but just to give you an idea, we looked at things like video consultations as part of the outpatient experience, remote monitoring of epilepsy, also quite simple technologies like pendant alarms, caregiver kind of apps and things like that, and also GPS tagging, so tagging an elderly relative with dementia who might go out and go wandering. And we deliberately chose a lot of very different technologies, different organisational settings, and they all had their challenges to implementation, which helped us develop this NAS framework. This is the NAS framework here. What I will do is go through each dimension very briefly. There's 7 dimensions in total of this NAS framework. But before I do that, I just wanted to highlight that this topic is really about complexity. And when you think about everything in life, things are either simple, complicated, or complex. So if you think of something simple, you might think about making a process of making a sandwich. It's very straightforward. There's very few parts to it, and it's very predictable. If you do everything in the same way and in the same order, you'll get the same sandwich. Building a rocket, you might think as being complicated. There's a lot more parts to it than a sandwich, but if you follow the manual and you do everything in the same way and in the same order, you'll get the same rocket. But something that's complex, you might think of bringing up a child. It doesn't matter what the manual says or the books that you buy, you get a different result each time. And the reason for that, and the problem with complex phenomena, is that they are, they're dynamic. They involve people. There's lots of interdependencies, and things are always changing. And we think that health technology support projects, the large majority of them, have a lot of complexity. So the NAS framework is all about trying to understand and categorise what is simple, complicated, and complex within a health technology project. So I'll just go through the various dimensions. The first thing you need to consider, and the first dimension, is the condition or illness. Now, a simple condition is well characterised, has a very clear diagnosis and treatment pathway. So you might think of a broken ankle as a simple condition. Cancer, you could consider to be a complicated condition. Once you know the grade and the type and the stage of the cancer, you have a pretty good idea of the treatment pathway, and you have a pretty good idea of your chances of survival. But complex conditions like dementia, mental health, heart failure, these are complex conditions, and they're not predictable. And for that reason, they're difficult to manage through algorithms. The second dimension is the technology. Now, a simple technology like the telephone, it's dependable, it's cheap, it's freestanding, it's easy to replace. It's easy to substitute, and people trust it. It provides information that you can easily understand. But complex technologies, and complexity happens when the technology is not yet quite interoperable with the wider system. It's less dependable. It might crash. It's not developed in its full form. And crucially, it might develop and it might present data or information that is not easily interpreted or needs some other learning to understand what it's saying. And people might not trust it as well. So that adds complexity. The third domain is what we call the value proposition. And there's two bits to this. You've got the supply value, return on investment and that sort of thing. But then you've got the demand side. Is it actually is it useful? Does it benefit patients and staff? And we found that things were simple, things went well when you had a strong business case and there was some evidence that the technology was wanted and there was some evidence of cost effectiveness and so on. Things got complex when the business case was weak. The evidence was unverifiable. It's based on a lot of assumptions that weren't shown to be accurate necessarily. And also a crucial thing as well is that it might not actually, there's a bit of lack of evidence or understanding as to what patients and staff actually wanted, and very difficult to get things going in those sorts of situations. Domain 4 is the adopters, it's the intended adopters. And we found that things were simple when the users, the staff or the patients, were able and willing to actually use the technology. And also, it didn't threaten their identity, and it didn't threaten or completely change their roles within that service. But if it becomes a lot more complex if the potential users lack capability to use the technology, or often what happens when things don't get going is that it threatens the potential user's identity or role within that particular setting. Domain 5 is about the organisations. And we found that things went well and things were simple when the participating organisations had good leadership. There was a shared kind of, clear vision of what the technology was going to do and what the benefits would be. And also the technology fitted into people's work routines and ways of doing things. But if you don't have that, things start to fall apart. If you have, if you lack that, if one or more of the participating teams lack that leadership or aren't willing to change, or if the technology leads to significant disruption to, hardwired work routines and ways of doing things, things become very difficult. Domain 6 is the wider system. So we found that things were simple and went well when there's a strong policy push, but also there's incentives and funding to actually support that development. And also you've got the various regulatory approvals and endorsement by professional bodies to support that. But if you don't have that, things become very difficult. You might have the top-down directive for the technology, but not the funding or not the incentives. Or you might get lukewarm or even hostile responses from relevant professional bodies towards the innovation. Final domain is around the ability of the intervention or the technology to adapt and to change in response to all sorts of other external factors. And if you're able to continually adapt and change the technology or care pathway, the sustainability is very good. But if it's implemented in a way that's difficult to change and is difficult to adapt, then they don't last very long due to all sorts of other things going on around it and external forces. So that was a really quick whiz through the various dimensions of the NAS framework. But I just wanted to sort of mention that this framework was very much initially developed as a kind of theoretical framework to help us understand, why some technology projects fail and why some succeed. But what we're doing now is developing an assessment tool to help think forward and help project planners to actually plan ahead and identify what aspects of their technology programs across those domains are particularly complex, and then start to address that complexity. This is something that's ongoing, we're still developing it. It's called the NAS-CAT tool. The CAT bit is complexity assessment tool. But as I say, we're developing it, we're piloting it with various other programs at the moment, and I'd be more than happy to tell you more about it over coffee, and even if you might be willing to use the tool as well. Thank you.